Dr. Patricia from Pantai Hospital, Kuala Lumpur. I am a consultant breast surgeon working at this hospital.
Hi everyone, I'm Dr. Saladina. Welcome to the International Women's Month. I'm here to answer all your queries and myths on regard to women's health.
A lot of women think that, oh, if I don't have family history, no one in my family has breast cancer, I can't get it, which is the wrong thing. Only 10% of all breast cancers run in families. 90% occur de novo, they occur on their own, so you have to do your checks. A lot of women think that if there's no pain, it can't be cancer. Another big mistake. Breast cancer, you get a lump, no pain. This is why it's important to also check your breasts every month after your periods. Women have two hormones that are important. The reproductive hormones are estrogen and progesterone. And the theory is that if only estrogen is acting on your breast, then the risk of breast cancer is slightly higher. What does this mean? This means that basically you have to have babies, you have to breastfeed, because this is what is going to protect your breast against breast cancer. Most important, breastfeed. If you can breastfeed your baby for 6 months, that's very good. If you can do 2 years, that's excellent. This is because then the good hormone, progesterone, is given a chance to act on your breast, and it is supposed to decrease your risk for breast cancer. PMS is premenstrual syndrome, and this is something that happens because of the changes of the hormones in your body during your menstrual cycle. It usually occurs about 4 to 5 days before your period starts, and it includes a lot of symptoms. So one of the commonest ones is irritability. You have mood swings, you can get some abdominal or muscular pain, sometimes even depression. You have difficulty in concentrating, the breasts become very swollen and painful, okay? But as soon as your menstruation starts, these symptoms usually disappear within a day or two. So that's premenstrual syndrome, and it can occur at some point in their life. Most women will have this, but it's not for every cycle of the menstrual cycle. Premenstrual dysphoric disorder, this is like PMS times 100. Symptoms are really bad, all the symptoms that I mentioned, but times 10. It usually occurs around the age of 25 or 26. Again, the symptoms are temporary. They usually will disappear with time, especially if you've had a pregnancy or you've had a baby. So yeah, it's not all bad news. It does get better with time. Yeah. Right, so it takes two hands to clap. So infertility, you have the male causes, you have the female causes. On the woman's side, one of the commonest causes is endometriosis. Endometriosis is when you have normal uterine lining tissue, but outside the uterus. Okay, so it causes bleeding into the abdomen, and because of that you get adhesions. Adhesions are when the organs sort of stick together, and because of that you may have infertility. That's one of the leading causes, but it can also be because of some of the treatments that are related to hormones as well may cause infertility in women. That too, of course. One of the leading causes then would be PCOS, or polycystic ovarian syndrome. This is again because of, it's multifactorial. So the baseline here is that there is too much estrogen, okay? And one of the most important causes of that is obesity. And we find that a lot of our children nowadays are tending towards obesity, probably because of all the junk food they eat. And the fat is always a storage for the hormones. So when your estrogen levels are very high, then the normal estrogen progesterone cycles during your menses doesn't occur, so you get irregular periods, and because of that, the eggs are not being released. If any of you went through teenage years and you felt your mother was like going psycho, that was menopause, okay? Right? The symptoms are many, okay? Some of the commonest symptoms are actually hot flushes. Something happens with the thermostat in the body, and even though you may be sitting in a snow-filled environment, you will feel very hot, and then you start to sweat. So that's a hot flash. And the problem with this is that it's very uncomfortable. You sweat quite a lot, and all your clothes may be wet. And then on top of that, this happens at night and wakes you up. So your sleep then becomes disturbed. Okay? You also can get mood swings, and the mood swings can actually, the very severe ones, you can get depression. You can actually become suicidal. Okay? So it's very important to look at the symptoms while this is going on, so that they can be managed by a gynecologist or somebody who is good at managing menopause-related symptoms. Okay, it usually occurs around the age of 50. Okay, but anywhere between 45 and 55 is actually normal. They say you normally or usually follow your mother, so it's usually around 50 to 52. Yeah, there are many treatments that we have for menopause, for the menopausal symptoms now. And it's because the hormones, the estrogen and progesterone, are actually on the decline. So we have what we call menopause, they used to call it hormone replacement therapy, or HRT. HRT had got such a bad name in the press that now we call it menopause related therapies, MRT now, okay? A hormone replacement or menopause replacement therapy, and basically we're just supplying hormones back to you. It is safe. We now know that it's safe. Unfortunately, we've not been able to do any scientific studies because of the bad reputation that HRT got. So we have to extrapolate from studies that were done earlier, and the general feeling is that 5 years of menopause replacement therapy is okay. You have to be on follow-up with your gynae as well as your breast surgeon, because we know that prolonged use, I would say 10 or 15 years of menopause replacement therapy or adding on hormones, there is a risk for breast cancer. So when you are on menopause replacement therapy, you must have your mammograms, ultrasounds, and a follow-up with the breast surgeon. But most important, after the age of 40, is to come for medical screening. Okay, for women, it's very important to get your mammograms, your ultrasounds, your pap smears done, and of course for thyroid and the other hormones, you have to do a blood test at least once a year.
Stress is one factor that will affect a lot of the endocrine organs. We have so many different organs that basically handles the endocrine system. It's a very complex system. So when someone is stressed, it affects the hypothalamus production, which will eventually affect all the end organs and affects your function. So a lot of things are very much affected by the way we think, and our stress is one of the factors. Maintaining healthy lifestyle starts with what you put in your mouth. So we need to be mindful with what we eat. It's not easy, and it's easier said than done. Be mindful of how much you ingest in terms of your salt, your sugar intake, and we need to enrich our food intake with fluids, with fresh food, vitamins, fresh fruits and vegetables. Exercise is another thing that a lot of us, when we are so busy with our day-to-day routine, we don't have the time to go and do exercise. But exercise is important, one of the factors to actually maintain good health. So once in a while, treat yourself. So go for pampering sessions, nice facial, that would make you feel happy. Take time for yourself is very important. On the contrary, it's not always the sign of breast cancer. It's often not the sign of breast cancer. Pain is more often than not is due to hormone changes. It is very much related to your period cycle. Yeah? Having said that, you can get discomfort when there is a growth in your breast that is enlarging progressively. You can feel heavy, you feel a bit of a dull pain. Yes, you can have those symptoms with breast cancer, but it is not the common symptom of breast cancer. What is the common symptom is basically a painless lump that is progressively increasing in size. It is often not noticeable in the beginning until it gets to a size maybe more than 2.5 cm or 2 cm. If you feel something like that, fast growing in your breast, not very painful, but it is hard and it doesn't move around, please come and have it checked. Well, dense tissue is something that we cannot choose. Yeah, women are born with certain anatomy, certain structure in their breast. It's just like how some women are born with D-cup breasts, some with A-cup breasts. You can't really choose how you're born with. Having said that, density is known to be associated with increased risk of breast cancer in postmenopausal women. So you cannot use the word dense breast for younger women who are still active, still having their hormones, who are still childbearing. Naturally, they're going to be dense. But it is only applicable, I would say, for women who are postmenopausal with dense breasts. Theoretically, the risk would be slightly higher than women who are less dense in their same age bracket. Endocrine system, like I said, is a very important system in our body that governs our overall metabolism, our overall energy level, our overall, I would say, well-being. It's basically comprises of a mixture of organs and different complexes. Yeah, the brain is one of the which is the hypothalamus, and the pituitary gland is one of the organs that is important in endocrine system, which will give signal to your end organ like your thyroid, your parathyroid, your ovaries, your testes, your pancreas, your adrenal gland. So these are the organs that produces these hormones. So the end organ produces the hormones. The stimulants and the control balance is from the brain. So when you are stressed, naturally your brain signal will be different, and it will trigger different influx of stimulants, which can be very bad for the body in the long run. The issues that you get with endocrine problems with women are mainly pancreatic related. It could be related to also thyroid, parathyroid, to the ovaries and the adrenal tissue. But there are women over the years, they develop low thyroid production in the end because of the repeated insults that occurs to the thyroid tissue, such as like chronic infection, simple viral infection that can lead to thyroid damage of the thyroid cells, which leads to hypothyroid. And a lot of women don't realize they have low thyroid until they come for checkup or do simple blood tests. And they often present with feeling tired, no mood, low sex drive, they put on weight, they come to check because of this. Of course, irregular periods, infertility is also one of the problems related to women when it comes to hormonal imbalance issue. Very much affected by our stress, because it's not easy to quantify stress, but stress itself produces stress hormones that will lead to a lot of myriads of issues.
Hello everyone, happy International Women's Day. I'm Dr. Chua from the Suisse clinic. Very delighted to be invited for Body Perfect's Ask the Expert segment in conjunction with the International Women's Month. Self-care is important to maintain a healthy relationship with yourself. It means taking the time to do things that help you live well, and caring for your skin should be the first step in your self-care routine. When your skin looks and feels good, we tend to feel better and more confident in ourselves. Well, the most common problem during adolescence would be acne. The hormonal changes in your body will increase the oil production, which will eventually lead to acne. So my recommendation would be to use a gentle cleanser, a non-comedogenic moisturizer, and avoid popping your pimple to prevent scarring and also further inflammation. For pregnant mothers, you need to watch out for stretch marks or hyperpigmentation. To prevent tummy stretch marks, make sure you moisturize your skin with either lotion or oil and avoid rapid weight gain. So hormonal changes in pregnancy can cause hyperpigmentation on the skin. So sunblock or products with vitamin C or niacinamide would greatly help in lighten up the pigments. Women into menopause will likely have dry, wrinkly skin due to the loss of collagen. So I would strongly suggest them to use products with ceramides, peptides, or antioxidants to delay the premature skin aging. A consistent skincare routine will provide a strong stability for your skin to go against the effects of stress and anxiety, and that should include a good, suitable moisturizer. Frequent moisturizing can help to restore and maintain your skin function as a barrier to prevent further water loss. A healthy skin is the foundation to a youthful face. It is crucial to remember that outward appearances do not define us, because all of us are beautiful in your own way. Home care skin regime is a necessity on a daily basis, but going for regular professional facial treatments would give you a better and outstanding result. Thank you everyone. Aging is a fact of life, but looking your age is not.